Dr. Chris Bunce, infectious disease specialist at Memorial Hospital in Jasper.
Hi, I'm Dr. Tretter and I'm the Chief Medical Officer at Memorial Hospital.
Well, I think it's real important that we keep in touch with our community leaders, with the governor, with the state, Indiana State Department of Health and all of their directives, and follow those guidelines. The big emphasis now is on social distancing as a way to prevent the spread. It's the greatest tool that we have right now. We don't have a medication or a vaccination for this at this time, so we need to put barriers in place that prevent this virus from going from person to person. And the only way we can do that is with social distancing, and that's why we've taken all these measures to close non-essential businesses, why we've closed schools and stopped various sporting events. We don't want people congregating. It is a known way to spread this virus.
At Memorial Hospital and Healthcare Center, we now have strict visitor restrictions, and those are available on our website, and you can learn more about that there. But the purpose of visitor restriction, again, is to really minimize the traffic into the hospital to keep our patients and our employees safe. We've also discontinued and postponed a number of elective surgeries or other procedures, so again, that we're not bringing people into the hospital unless it's absolutely necessary. So what we're learning from others throughout the country and really around the world is that this virus has a pattern in which the number of cases become more and more prevalent in a certain region. So far, we have a limited number of patients who have tested positive for coronavirus in our community, but we anticipate that number is going to continue to rise. As that rises, we will likely have more and more patients who require medical care in our hospital. We've taken a number of steps to prepare for an increased number of inpatients over the next coming weeks. We have been working with our staff to prepare them so that they have the necessary equipment to care for patients. We have looked at our resources in terms of the beds that we have available, as well as ventilators, which are breathing machines to help people who really are critically ill during this time. So we've been doing a number of preparations, both locally as well as working with partners within our community and around the state and region to really prepare for that influx of patients.
And Dr. Tretter, I'd like to also emphasize that what people in the community can do to help you, to help the hospital, is to follow the guidelines of social distancing. There is a way that you and the community can help blunt this surge, and that will be the best thing you can do for your local hospital. It will be the best thing you can do to allow them to take care of patients in an orderly fashion so that they're not overwhelmed by hospital admissions.
So we have several options that patients can use. We have a phone triage number. The number is 812-996-6330, which is a phone line dedicated to patients who have questions about their symptoms and possible COVID-19 illness. We also have a location located at 625 West 2nd Street in Jasper, which is right across the street from IGA grocery store. That's a Memorial Hospital clinic which is dedicated to patients who have symptoms of fever, cough, or shortness of breath. This is a screening site in which you will be seen by a provider and have some testing done to rule out other common causes of respiratory illness, such as flu, strep, or pneumonia. We also have the ability to test patients for COVID-19 if they meet criteria as defined by the Indiana State Department of Health. We encourage patients to come to this clinic or call our triage number as opposed to going to their primary care provider or to the emergency department unless they have critical symptoms that require emergency care. Then, of course, the emergency department would be the most appropriate place to go.
Criteria for testing has evolved over time. Obviously, testing was critically short. We had very few testing kits early on. That is starting to improve. Also, the turnaround time for testing is starting to improve as well. So we've gradually expanded the indications for testing. People really have to have some sort of respiratory respiratory symptoms, cough, fever, shortness of breath, as Dr. Tretter mentioned. People who, of course, are thought sick enough to be in the hospital with those symptoms will definitely get tested. People who work as first responders, people who have been exposed in the medical care setting who develop those symptoms will also be tested. Certainly people who have special circumstances like the homeless, and people who are older, people who are compromised in any way will be prioritized for testing. And so it's important that those testing criteria will probably expand, continue to expand as testing becomes more available, but we probably won't be testing people without any symptoms at all, except under very special circumstances.
I think it's also important for people to understand that the great majority of people who do test positive or do contact the coronavirus will likely have mild symptoms that they can care for at home. The most important thing those individuals can do is simply stay home and isolate yourself from others so that you don't spread the virus to others. Certainly some patients who do develop coronavirus illness will become sick enough that they do require hospitalization and further care. So certainly if symptoms worsen over the course of the illness, it would be appropriate to seek medical help or contact your professional, to contact your primary care provider.
Well, I think it's real important to reach out to people who are feeling sort of isolated. As these measures go on and on and on, people are going to have start to get tired of them, and frankly, and you have to be very, very careful that you reach out to people who might be lonely, who might be feeling isolated. I'm thinking particularly our elderly community, people who have to stay in place. It's good to visit them, keep your distance. If you have to shop for an elderly relative, make sure you get them their essentials, make sure that you call ahead, make sure that you have a list. If you go to the grocery store, go alone. If you go to see them, reach out, talk to them, but don't spend a lot of time. A lot of face-to-face time is the way this can be transmitted. In addition, I encourage the use of social media, FaceTiming, just the old-fashioned telephone. Reach out and find out how people are doing and reassure them that this isn't going to last forever, but they're going to have to hang in there while it does.
I agree with those recommendations, and certainly this is a challenging time for all of us, and this is when we need to pull together as a community and really be there for each other and to support each other. But we have to find ways to do so that avoids that person-to-person contact. And so I think Dr. Bunce's suggestions are very appropriate. We do need to reach out, we need to stay in contact with each other, but we need to do so without that physical contact as much as possible.
Think we're overdoing it, then we're doing it just right, because we're on the low part of the slope. Mm-hmm. You know, that's the thing, and I think that's the great advantage I think that Du Bois County has, because you really are on the very low part of the slope right now. Mm-hmm. And that should be even more motivation, not less motivation, right, to stay inside. Anyway. Right.
Thank you for your time and attention today. Certainly if you need more information, we ask that you visit our website at www.mhhcc.org, or you can visit the website of the Indiana State Department of Health or the CDC, both of which have good, reliable information for you.
Yes, and thank you very much for the efforts that you're putting into this in a very, very unusual and stressful time. Remember that when you stay at home and stay away from others, you're serving your community.